As you may know, pregnancy in sickle cell disease is high risk, and there are very few treatments that are safe to give women with sickle cell disease, and particularly that have been well studied. At the moment, chronic transfusions are the only disease-modifying therapy for individuals with sickle cell disease who are pregnant. And there is a meta-analysis that supports their use in the prevention of many common sickle cell complications in pregnancy, but there's not yet consensus on when to use transfusions. The purpose of our paper was to look in a multinational database of pregnant people with sickle cell disease and determine the rate of alloimmunization in this population of patients, and also to look at the number of patients who would have met if the American Society of Hematology ASH transfusion guidelines had been followed in treating these patients, how many of the patients would have at least been candidates for transfusion using those guidelines. So this study included 145 singleton pregnancies who were either treated with what we called on-demand transfusions versus chronic transfusion therapy. So on-demand transfusions are patients who are given transfusions when clinically needed, but are not on a scheduled prophylactic transfusion regimen. In our cohort, there were 119 subjects who received on-demand transfusions and 26 who were receiving chronic transfusions. Among the subjects who were transfused on a just as needed basis, 46 out of 119 of them received at least one transfusion during pregnancy. Our chronically transfused subjects had more severe sickle cell disease at baseline, as you might expect in a non-randomized cohort. However, during pregnancy, sickle cell severity did not differ between the two groups. And additional data on this patient population: before pregnancy, 18 patients were alloimmunized, and that did not differ by treatment group. 6 out of 26 patients receiving chronic transfusions were alloimmunized, compared to 12 of 119 patients receiving on-demand transfusions. There were 6 subjects in this study who developed an alloantibody during their pregnancy, and this did not differ by treatment group. Half of the patients already had a history of alloimmunization, and 3 did not. All of the subjects with new antibodies and a history of alloimmunization developed anti-Kel antibodies, whereas those without a history of alloimmunization developed anti-KID antibodies, which are not usually preventable, even if you follow the ASH transfusion guidelines. In our secondary analysis, we looked at all patients in this multinational cohort, which is 299 pregnancies to 203 subjects. And for this, we were looking at how many would have been eligible, how many would have met criteria to at least consider chronic transfusions during pregnancy. And we identified that 83% of the pregnancies met some component of the American Society of Hematology guideline criteria for initiating chronic transfusions in pregnancy. And this included all of the subjects who received chronic transfusions, and 79% of the patients who were treated with on-demand transfusions during their pregnancy. And so, first of all, we conclude that there was a low rate of alloimmunization that does not differ between chronically transfused and on-demand transfused populations in this cohort, and that some of the antigen matching would avoid alloimmunization if it was followed for these patients. And finally, that there is a high there's a high number of patients for whom chronic transfusions, which prevent many common and morbid sickle cell and pregnancy complications, may be more broadly indicated than is currently considered, at least if this cohort is any indication.